My name is Margaret Wanyoro. I am the Youth Advisory Champions for Health President, Kiambu County. This is a group of young people that advocates for the health rights of adolescents and young people. When we talk of health rights, we have sexual reproductive health rights, we have gender-based violence, we have HIV, ending stigma and infections. We also have issues to do with mental health. So we have members from each and every sub-county, from all the sub-counties in Kiambu County. That's the 12 sub-counties. Then generally it's an abbreviation for local innovation scaled through enterprise network. And this is a program that majorly focuses on what the community is doing and also on helping the community to find solutions for the problems they face. So Listen came in and we got to be a community of practice in this program. And generally, we found ourselves doing so much and efficiently by helping the people that we work with. Generally, Listen has made it easier for us to interact with the people that we serve, our fellow adolescents and young people, in that we get to understand the problems they are facing from their own perspective and not from what we think. And we've also been in a position to actually get the solutions to their problems from them, which has made it easier and has made it more sustainable, or the solutions that they come up with, they become more sustainable, including the programs that we've been having with these young people. And so thanks to Listen, at times we won't be finding ourselves repeating the same thing again and again, since we are having the community adopting the programs way much better and with a positive approach and perspective. Listen has really helped us in HIV programming, in that we have more young people coming for HIV testing. We've seen an increase, especially in the last 6 months. This has really increased. And it's probably because when creating awareness, we are doing it, or young people, or generally adolescents and young people have become a part of understanding what HIV really is, the various prevention methods, and how to best take care of themselves. So this has actually seen an increase in the uptake of HIV testing. And also, apart from HIV testing, we can also talk of prevention, where we have more young people, and especially women, taking much care of their reproductive health by the increased uptake of condoms. We've seen this especially in the various universities that we've been distributing condoms. We have more women, more ladies, that is, coming for condoms compared to men. And also we are having a lot of teenage girls, especially going for reproductive health services, going for contraceptives, because through Listen we've been in a position to reach more young people out here and campaigning against issues to do with teen pregnancies, which means with time we are really hoping to have a reduced number of teen pregnancies probably in the years to come, given the uptake of contraceptives and family planning. Through a very intense training on human-centered design that was spearheaded by Listen, we as a community of practice were actually trained on how to actually do our activities focusing on the young people, or on the community who are actually the people who are uptaking the services. And so with this, with the fact that we are also trying to incorporate our information in their day-to-day activities, we realize that we are not really interrupting what they do on day-to-day basis, which means even convincing them to actually go for these services, it has been way much easier, because there's no much difference that there's nothing much really that we are bringing in. We are just adding them something onto their daily schedule. And so with this, we've realized a lot of people going for all these services, all these health services. And we are really hoping to have an increase, because we are also trying to, for sustainability purposes, we are also creating champions, in that we are training more people on HCD from what we know, of course, at a basics level, in that we are hoping that the champions will go create more champions, and through that we'll have more sustainable programs within the community, in that even when the Listen program is actually over, we'll still have the activities that we started going on. Now we have the champions actually spread in various sub-counties. In every sub-county, we are ensuring that we have 15 champions. So far we've gone to 3 sub-counties. And we are hoping that by mid of this year, we'll at least have covered up to 5. If you look at our community and if you look at young people and I as a young person, we face a lot of challenges. And most of the times you realize that even the people that are out there to come up with solutions for us, they are not really young people, which means they really do not understand what we go through. That meant there needed to be a young person, not only in the policy making desk, but also in the implementation grounds, to ensure that whatever is actually, whatever is going on is actually for the young people. And so with that, the group that I lead, Youth Advisory Champions for Health, what we say is that there's nothing for us without us. So that actually explains why we are there. We need to be there for our young people to ensure whatever comes up is actually what we really want and what will actually help us. We've been doing activities and we've been collecting data, and we normally do our monthly report. We do reports monthly, which means most of the times we really don't report, we don't really make the reports right after the activity. It is just when the month is about to end and we remember we really needed to make a report. And so we really need to retrieve whatever we had, most of the times from our memories and what happened. And given that we were doing at times it was not a comprehensive report, and now comparing it to what we are doing right here, this means that we'll be sending instant data and raw data. Actually, we are having a training on online reporting tool, and I really appreciate what's happening right now. I really appreciate the Listen for actually for doing this, because this will mean that to start with, we'll get instant data, raw data, unedited, and that will also be in a position to capture almost all the details, all the necessary details that happened in that event. And at the same time, we also feel that even when it gets to the stakeholders that we partner with, it will be way much easier to actually tell them, let's get to a certain site and you'll see what we've been doing at whatever time of the year, whatever time of the month or of the week. We've made impressive steps before, and looking at it right now with the Listen program with us here, I know that we are actually going miles in the fight against HIV, given that we now have we now have a way to maximize the resources that we have. Because at times you realize that the major problem that we have is actually resources. We really don't have enough resources. Listen is actually giving us alternatives, and even better alternatives to maximize on the resources that we have in the fight against HIV. So we're still looking forward to zero new infections, and we know that with Listen in place and with all the trainings that we've had, and with the more trainings that we'll continue having even in the community level, with time, we really pray and hope that we'll actually get to a point where we'll have zero new infections in the community. My message to every young person out there watching me is that the fight against HIV is each and every person's responsibility. And we really need to ensure that we are protecting ourselves and we are protecting the people around us. So we really don't have to wait for other people out there to come and tell us what to do. We just need to start with the basics, what we actually know about this fight. For example, a simple use of a condom.